All right, everyone, Mix 1041 on the radio, Talk 1013, and on Mix TV. And we are joined once again by the State Health Commissioner. She is Dr. Lisa Piercy. Doctor, how are you?
Doing great. I am glad to be here with you. Thanks for having me on again.
Thank you so much. And, I just want to begin with an obvious question, I guess. In your estimation, where are we as far as this pandemic is concerned?
To be quite honest, I wish we were done, but unfortunately we are not. It's not done with us. So, we had a big surge about this time last year, last winter, and then we had a very serious surge in the late summer, August, September. And then about a week or two before Christmas, so about a month ago, we started really getting hit hard and fast with the Omicron variant. And the difference with the Omicron variant and the others, which we call Alpha and Delta, is that it is super highly transmissible, which means it's really, really contagious. It also evades a lot of the vaccine protection. And so what that ended up with is just exorbitant numbers of people who were infected. Right now, our weekly average is about 1.5 times the highest peak of the last two surges. And so there are a lot of people that have it right now. Couple of notes of good news. One of those is it's widely known that this variant is not as severe, so people aren't getting as sick, which is a good thing. Now, they still have to be out of work, and it still does cause people some serious illness, so it's not to be taken lightly. But that is one piece of good news. The other piece of good news that literally we've just noticed in the last day or two is that our metro areas, so all of the major cities in Tennessee, are starting to plateau. And generally speaking, if history continues to repeat itself, the rural areas will follow in the next 2 or 3 weeks. So I'm very, very hopeful that by the end of the month, we're going to be in a downslope.
We're joined by Dr. Lisa Piercy. She is our health commissioner in the volunteer state of Tennessee. And I want to just get your thoughts. One of your colleagues, one of the most famous obviously infectious disease doctors, Dr. William Schaffner at Vanderbilt, he made news a couple of days ago when he said he thought that we may be in an endemic phase by mid-February. What do you make of that, and do you agree with that?
I certainly have a ton of respect for Dr. Schaffner and agree with him that we are getting close to this being more endemic level. I'm not confident enough to make a prediction yet on time, but I'm very hopeful, and I hope I'm right. I'm very hopeful that this is the last surge in the sort of the pandemic phase. And it's a good question of, well, what's the difference between a pandemic and endemic, and how do we know that we're there? I do want to warn you, there is no specific trigger or date that the switch is going to be flipped, but we do know that over time, this is going to become just one of those things that we have to deal with, just like we do with flu. We're not really sure yet if it's going to be seasonal or if it's just going to kind of be random like it has been recently, but we do believe that this is probably the last surge of the pandemic phase before we move into a more normal endemic phase.
So what do you tell people? What do you tell people they need to be doing right now in order to stay as safe as they possibly can?
I wish I had something new and novel to tell you, but it's the same thing we've been saying for at least the last year, and a lot of the things for the last 2 years. So specifically, the absolute number one thing you can do to protect yourself and those around you is get vaccinated. If you haven't been vaccinated in what we call a primary series, so you haven't gotten any vaccines at all, it is not too late to do that. It is absolutely still fine to get that done. Likewise, if it's been more than 2 months since a Johnson & Johnson vaccine or 5 months from a Pfizer or Moderna, you need to get a booster. And so those booster shots really help protect you against the Omicron variant, not only getting infected, but getting severely infected. And then you need to do those same things that we've been talking about for 2 years. Everybody's tired of hearing them, but they still work. Stay at home if you're sick. Even if you think it's probably sinuses or, it's just a little cold. Actually, statistically, it's probably COVID right now.
Yeah.
And so if you're not feeling well, you need to stay at home. And then likewise, lots of hand washing. If you're in a crowded space, particularly if you're high risk, consider wearing a mask and make sure that those around you, particularly who are most vulnerable, elderly family members, those with high risk medical conditions, they absolutely need to be protected more than any of the rest of us.
We're joined by State Health Commissioner Dr. Lisa Piercy. What do you make of the federal government's response? Because, as we tape this interview here today, the president has given his first news conference in quite a while. He spoke for a couple of hours, and part of that, obviously, COVID and the pandemic was very much a part of that. A couple of things, the last week or so, the federal government sending out making the at-home test available. I'd love to get your thoughts on those. I've heard some anecdotal things about how accurate those would be, so some concern there. And then also the government is sending out, I believe, 400,000, and correct me if I'm wrong, I guess they're the surgical mask, I believe. Is that correct?
Well, sort of. So let me talk about testing first,
Please.
and then I'll talk about the mask. So related to testing, one of the biggest concerns we've had throughout the Omicron surge is the availability of rapid at-home testing. The days of having to go wait in your car or stand in line for hours at a time for a traditional PCR test, fortunately, those are becoming less necessary because of the spread of at-home tests. But it's still pretty hard to find them at retailers. You can get them at the large drugstore chains. But the thing that the federal government has done in the last just couple of days, actually, is make them available to ship directly to every household in America. And I've signed up myself. It's very easy. It's COVID tests with an S on the end, .gov. And you just put in your address. It's literally only 3 or 4 clicks, and every address will get 4 free tests sent to them. So if your listeners and viewers haven't done that, strongly encourage you to do that, because as you know, you don't want to wait until you start to show symptoms before you get a test. You can have it on hand and then go ahead and check yourself right there at home. Now, related to the mask, yesterday the president announced 400 million N95 masks being made available through the Strategic National Stockpile. So they have plans to distribute those in retail spaces and in clinic spaces. And N95 masks, or sometimes they're called KN95 masks, are the ones that have the highest protection. And so particularly more so than cloth masks, as it pertains to the Omicron variant, cloth masks have been shown not to really be effective much at all. The surgical masks are better, but the N95s are, they do offer the highest protection. So that's what the 95 is for. They filter out about 95% of the pathogens that you both breathe in or breathe out. So it is the highest level of mask protection. And so that was a positive sign to see that those are going to be made available for free.
We're joined by Dr. Lisa Piercy. She is our top health official in the volunteer state. And Doctor, just a couple of more questions here. And, it seems, I don't know, a few weeks ago or something, the State Health Department decided to not do the daily updating of the numbers and have gone to a weekly format. Why was that?
Yeah, that's a great question. And it actually has a lot to do with what I just got through talking about on at-home testing. So one of the reasons is the population at large is shifting to at-home testing versus going to those traditional sites. What may surprise you is that almost none of those home tests are being reported to the state. There are a couple of vendors who do report them, but for by and large, it is just like if you were to take a pregnancy test at home, that is your interpretation, and that doesn't get reported to anyone. Same kind of thing. So we know already that our numbers are inaccurate and significantly underestimated because of that. Secondly, this is something that we have quickly realized this is not going anywhere anytime soon. So we have, just as we were talking earlier about moving into endemic, we have to start treating it like that. And so when you think about how do we report flu metrics, flu is reported weekly, and frankly, it doesn't really change what you do week over week if the number is, a little higher or a little lower. What you need to look at is trends. And so that's what our new data is showing, is the trends in direction. Is it still going up? Is it plateauing out? Is it starting to go down? Because your day-to-day actions should not be any different. Fortunately, we're seeing a lot of states moving towards that same normal weekly cadence instead of the daily cadence. And at last count, I think there are about 20 or almost half of the states are now reducing the frequency of their data reporting. And you're starting to see other entities like the Associated Press saying, hey guys, don't report on daily numbers anymore because it's not very useful like it used to be.
All right, final question as we tape this today, and I say final question, maybe one follow-up here. But a federal judge ruled that the former state vaccination chief, Dr. Michelle Fiscus, cannot pursue claims for monetary damages against the state's top two Department of Health officials after her firing last summer, that being yourself, also Chief Medical Officer Tenn Jones. They cited qualified immunity, a legal doctrine. Any comments you have on that, Dr. Piercy?
Just two brief comments. I'm not an attorney, so I rely on those. And secondly, we don't comment on pending litigation, so I would have to pass anyway.
All right, doctor. And just a final summation as far as Tennesseans and especially those in our Southeast Tennessee listening and viewing area. How do we live our lives, Dr. Piercy? What do we need to do? Just kind of a final comment from you.
Great. It's a great question, and I love the way it was phrased because that is what I want you to do. I want you to live your lives, but I want you to do it as safely as possible. And there is no safer way to do it than to be vaccinated. And so if you haven't been vaccinated and you still have questions, talk to your doctor. You don't have to trust the government. And please don't trust social media. It's where a lot of people get their information, but it's oftentimes not accurate or complete. Talk to your trusted medical provider, talk to your clergyman, talk to those around you who know what they're talking about, and get your questions answered, because there is nothing you can do that will protect you more than being vaccinated. And then continue to go out there and do what you do, because we cannot put our lives on hold for this. We need to learn to normalize this in our day-to-day lives and being as safe as we can. So I encourage everyone to do that.
Our state health commissioner of the volunteer state of Tennessee, Dr. Lisa Piercy. Dr. Piercy, I can't imagine how busy you are. Thank you so much for doing this.
Thanks for having me and continuing to shed light on this super important topic.